Heart failure happens when the body asks too much, more than the heart can do. There's a gap between demand and supply. If you have both, where you have poor supply and high demand, heart failure, that gap is a big problem. Symptoms of heart failure are primarily three. One is shortness of breath with exertion. Another is ankle swelling. And perhaps the most important is shortness of breath when lying flat. So what we want is for everybody with heart failure to get an accurate diagnosis, why they have heart failure. Is it a demand problem? Is it a supply problem? Is it a both problem? And then to try to fix those. Reducing the demand by taking the heart rate down, taking the blood pressure down, correcting the thyroid, correcting the anemia, or making the heart muscle stronger by blocking those hormone things that occur. All that can be done for people with heart failure and improve not only how they feel, but how long they live. Just cutting back on salt, getting the blood pressure control, those are things that we start with for just about everybody, but especially heart failure patients. Sometimes if the heart failure is there because of a valve problem, a valve that's too tight or a valve that leaks, we can repair that. There are some things that can be done to affect the heart rhythm. Certain rhythms of the heart, if it gets out of cadence, it doesn't perform as well. We can repair those rhythm problems and streamline the performance of the heart and make it do better. Used to be that the average person that got diagnosed with heart failure had about 2 years to live. Today we have people 20 and 30 years later on medical therapy and with interventions that are surviving with heart failure. So it's an exciting time to be managing heart failure because we can tell just about everybody, we can make you feel better. And not only that, we can give you life. We can make you live longer if we treat your heart failure appropriately.